Okay, thank you. I think I'm one of the few clinicians in the room here. One of my colleagues, Ross, is sitting over there, and I'd like him to remember how I was described as being a distinguished speaker, Ross. Something that's not very common. Thank you for the opportunity to talk. As a clinician, I have a fairly simplistic view on this. I don't have a lot of pressures that some policymakers will have to do with competing interests. And I thought I'm just going to share some thoughts about pregnancy and nicotine. Essentially, it's to do with vaping. But I'm using nicotine because we talk about smoking cessation. The big baddie is nicotine, and that nicotine isn't just a thing that gets you hooked. Nicotine itself is fairly toxic. So I think we do need to be concentrating on nicotine reduction. The American Heart Association talk about reducing smoking, combustible smoking, but they call it as part of their nicotine endgame, because nicotine itself is a nasty product. Anyway, I would say I'm going to go through things fairly quickly. I'm going to spend a little bit of time talking about some of the evidence base that is used to suggest that vaping is safe. So this is the outline. I'm not necessarily going to do this in this order, but this is what I thought I would talk about is it safe to use e-cigarettes, to do with the mother, the baby, and also a little bit about smoking cessation. So you'll probably all be aware of this fact or factoid that is continually repeated. This is from the BBC website, and it was a story when San Francisco had banned sales of e-cigarettes, and they ran a story saying, well, is there any risk? And they talked about doctors and people saying that the risk of vapes compared to cigarettes was 95%. They're 95% safer. Very specific number. And like all times you hear any talk about vaping in the media, there's a picture not of a 60, 70-year-old man who's desperately trying to give up smoking for health reasons. It's usually a young professional who is clearly enjoying the vape. So it's interesting how that subliminal message is always out there. So where that 95% figure comes from is from a study which is mentioned here by Nutt and others. So this is a fairly recent document from the group that used to be Public Health England, where again in September 2022 they repeated this figure, saying that 95% less harmful. And they referenced their 2015 report, and they referenced 2 papers, and they also commented how the Royal College of Physicians had agreed with them. So to talk about the Nutt paper, which some of you may be aware of, some of you might not be. Oh, sorry, I meant to mention this. This was the Royal College of Physicians report, which used exactly the same picture on their official report about reducing harms from smoking. Not, again, an old person who's an established smoker, but the young professional we saw earlier, which is a commercially available picture. Anyway, to talk about the Nutt paper. Now, this paper appeared in 2014, and it wasn't actually a paper looking at harm to an individual from cigarettes compared to other products. It was a paper looking at harm to the whole world in general, because they split it up into 2 groups. They had to the user and then to the others. They talked about smuggling, they talked about deforestation. That was the point of the paper. It wasn't to talk about individual harm to a person. It was a group of international experts who apparently were convened. They had different backgrounds. There's a lawyer in there, there's an ophthalmologist, was a respiratory pediatrician who was noted at the time did not declare his interest in how he'd receive funding from cigarette companies and vaping companies. And it was also supported by these 2 groups here, which again at the time was pointed out are funded by vaping and big tobacco companies. So already the problem with the study is there's this, to people like me, tainting. Also, as I said, it wasn't there to look at the individual. But what they did was they did a modified Delphi process where they decided on various harms, they decided how to weight things, and then because smoking was so much more prevalent than vaping, they added a multiplication factor, because they were looking at harm to the world in general, not to the individual. And that's where the 95% figure came from. And this was before most of the research that we now know from acute harm, EVALI, came out after this, and also a lot of the research has actually superseded this study in any case. But it's still referenced. Sorry for the kind of slightly untidiness of this, but the other paper that there was referenced in this was this West paper, and this was actually a document that was presented to the government on, I think, 3 occasions, and they used 95% less harmful. They then referenced this paper here, which does not mention 95% harmful. It actually says, well, maybe it's more harmful than smoking, or maybe it's less harmful than smoking. It didn't actually come out with anything to say they thought it was less harmful. So the premise that these 2 papers are giving us good evidence, I think, is clearly not there. Also, the Royal College of Physicians that was commented on, their references were not, and the original Public Health England report. So what we have is circular reporting. This is from Wikipedia, which shows that by giving examples of different references, you give the suggestion that there's actually a body of evidence, which there isn't. And either that means, as it says here, it's happens mistakenly through sloppy reporting, or maybe it's intentionally contrived. I don't know. But what I think I can say is, I don't think the evidence that was produced in that report, 2022, is actually powerful. If we look at other journals and looking for evidence, the Lancet and the New England Journal are often promoted as being the best of the general journals. There's other journals like the Journal of Clinical Oncology, which concentrates obviously on oncology. But the Lancet and the New England Journal will consistently vie to be the best journals for general topics. And there is a paper that was recently produced in the New England Journal. I have a copy here, see, very big. Most of it, it's only about 15 pages long, the actual paper, but most of it is them setting out the evidence that they use to come to their conclusions. So it's very open for people to look at and criticise if they need to. 2024, it's just been published just now. And what they suggest is that we should reassess the assumption that e-cigarettes do not provide harm compared to cigarettes. And particularly if you're dual using. So if you are continuing to use cigarettes but have cut down because you're using vapes, that is particularly bad for you. The other thing that is interesting is, talking about smoking cessation, is that dual use, this is to do with dual use, just emphasizing the point, that I made, that it was 20 to 40% higher compared to just e-cigarettes or just smoking. If we're looking at cessation, this is an umbrella review. Now, an umbrella review is very powerful. It takes a lot of meta-analysis, puts them all together, you get an umbrella review. So this again is very strong evidence. And when we're looking at smoking cessation, former smokers using e-cigarettes have twice the odds of relapse as non-e-cigarette users. So if we're looking at safety, if we're looking at smoking cessation for pregnant mothers who are users, then I think the evidence is that it is likely that e-cigarettes are harmful. They're at least more harmful than is suggested from this 95% figure. And if you're using them as smoking cessation aids, it probably isn't effective. The evidence is probably that you're more likely to relapse. So that's for the mothers. Now, I got interested in vaping because I am a pediatrician, I do a respiratory clinic, and I was seeing children, as we've discussed already, being targeted who are increasing in their vaping, and I was seeing the harms, which, as I say, we were seeing physical harms. We had concerns about what this would mean for the future, and so myself and a few colleagues around the UK got quite concerned and started raising these concerns in journals. This is from the Archives of Disease of Childhood, and this is from the BMJ. There's another group. Oh, sorry, this last one. I'll just put this up. This is from one of my colleagues, Kenny, who works in Edinburgh. And if you maybe just want to read it yourself, this is part of why we were getting concerned. Kenny is a respiratory physician in Edinburgh. So we felt that there was this group that were being targeted, that were getting harms, and I say that made us get involved. As a neonatologist, I look after newborn babies. And so again, my concern is that if adults, because we all agree that adults do silly things, adults should be allowed to do silly things, but if adults were being targeted with false information, the 95% safer, then the risks are to the unborn child. And again, that did not seem right. And there's starting to be evidence that's been produced in papers suggesting that e-cigarettes, or at least nicotine replacement, is not harmful. So this is from a fairly recent paper when it was looking at e-cigarettes and nicotine patches. The vast majority of people who were using nicotine replacement in this study were using e-cigarettes. I think it was 10 times was the ratio. When they looked at this to suggest that, in their opinion, it was safe, they looked at the birth weight of the baby. Birth weight has got lots of factors. Size of the mother, size of the father. Does the mother have diabetes? Is the mother very small? If you took several 100,000 people, all of these factors would even out. This was quite a small study. So to say that if we looked at the birth weight of the people using nicotine products, and we can see that it's not different from people who aren't smoking, that means it must be safe, is not a good assumption to make. Interestingly, they showed lots of adverse outcomes were more common in non-smokers who weren't using any nicotine, which might suggest that everybody should use nicotine when they're pregnant. But they then said, oh, well, our sample size is so small that we should discount this. But they were quite happy to take what they thought was a positive outcome from this. If you look at their figures, it's interesting. In that there are different groups. They had abstainers who use nicotine products. I say most of these were e-cigarettes. At the start, they had quite high levels of nicotine, which actually reduced, compared to smokers who continued, who use nicotine products, and reducers. A reducer was somebody who reduced by about 50%. So these people are dual users. Their nicotine levels went up. So my take on this paper is, if there's any information that you can take from it, is your birth weight is higher if you have a lower toxic level of nicotine in your blood, as opposed to being safe. And that's because, as I say, nicotine in itself is bad. It is difficult to look at humans and to separate out human studies to say, well, this person is smoking, this person is using e-cigarettes or whatever. You can't randomize people. But you can do animal studies. So this is all from animal studies, and it's from this paper here, and it shows that there's damage to the brain, there's damage to the heart, damage to the developing lungs, also increased risk of cancers. So in itself, nicotine is bad. Now you might say, well, that then causes a problem with nicotine replacement therapy if someone who's pregnant. But if you are someone that is pregnant and you're using nicotine patches, you're probably going down the route of trying to stop smoking, to reduce the nicotine load, as opposed to someone who is told that the e-cigarettes are safe, 95% safer, therefore they are probably going to continue to use nicotine. So these were the conclusions that they had from this paper, and this is what was reported in the papers. This was from the Metro. So e-cigarettes help pregnant smokers quit without risks. Harms to pregnancy from smoking are likely due to other chemicals. They had no evidence for that, but this is what was reported in the papers. So in summary, I think we can probably say that vaping is not a safe alternative. We should challenge anybody that uses 95% safer. The 95% safer message should be consigned to history. When Sheila did a television a kind of program a year ago, was it? This figure was brought up by the industry person, 95% safer. Public Health England says it's 95% safer. We should be challenging it and not mentioning it at all. I don't think there's any evidence that vaping is an effective cessation aid. And interestingly enough, reduction does not reduce risk in a linear manner. If you go down from 20 cigarettes to 1 cigarette a day, and you're a man, you have a 53% reduction. Not a massive reduction, a 53% reduction in your heart disease, a 64% reduction in stroke. The figures are a little bit better if you're a woman. I've just chosen to use the larger figures. I think we can say that nicotine is a nasty drug. There's increasing evidence that itself is a nasty drug, and that's why we should be concentrating on nicotine reduction. And you heard, some of you maybe at the Parliament yesterday, you heard the children talking from Larbert School. If you are an adolescent, you often get hooked, like that person whose story I put up. You have problems with concentrating. It also is most likely to be a gateway to combustible tobacco. We've had fantastic success in Scotland and like other countries in the reduction in smoking over the years. In Australia, the most recent figures have shown that smoking has gone up in the young age group, the group that use vapes. And I say there's other evidence that it's a gateway to smoking. And I think that it's clear that nicotine itself has adverse effects on the fetus. And that's all I'm going to say just now. Happy to take any questions or thoughts later.